This is a Patient Safety Minute brought to you by Fortress, an informative overview of patient safety strategies and educational resources available to dental professionals and their staff. Informed consent is considered by some to be the discussion between a doctor and a patient, while others associate it with a signed consent form. In reality, both are an equally important part of the informed consent process. In this segment, we discuss the recommended steps in the process that, when properly implemented, help the patient learn about and understand the purpose, benefits, risks, and alternatives to treatment, and ultimately allow the patient to make an informed decision on whether or not to proceed. The first step is a conversation between the treating doctor and the patient. This conversation should be unique to each patient, and the doctor should discuss the diagnosis, proposed treatment, anesthesia options, benefits, the risks and potential complications of treatment and anesthesia, the risks of refusing proposed treatment, and treatment alternatives, including no treatment. Any pre-existing conditions which could impact treatment should also be discussed. This is also the time to review pre- and post-operative instructions related to the proposed treatment. To help ensure the patient fully understands the procedure and potential risks, conduct all conversations at the intellectual level of each patient. Bring in a qualified interpreter if needed, and support the discussion with visual aids when appropriate. To assess the patient's understanding of the information shared, ask patients to summarize the discussion and give them an opportunity to ask questions and address concerns. It is important to remember that the doctor performing the procedure must obtain informed consent. However, staff may assist in the process. In the second step, the patient should sign a consent form to acknowledge their understanding and acceptance of the information discussed. The form should be patient and procedure specific, include the type of anesthesia elected by the patient, and outline any potential risks. Forms should be signed in the office. This allows the patient, the treating doctor, and preferably a witness to sign the consent form contemporaneously. Keep in mind that the patient should sign the form after the informed consent discussion, but before the procedure or any anesthetics, mind-altering medications, or narcotics are administered. The final step in the informed consent process is proper documentation in the patient record. Document the discussion with the patient. Be sure to note that the patient verbally accepted the plan and signed the consent form, acknowledging the risks. Append the signed and dated consent form to the patient record to fully document the informed consent process. A library of procedure-specific consent forms, available in both English and Spanish versions, can be downloaded from our website and customized for use in your practice. Informed consent allows each patient to make an educated decision to proceed with your recommended treatment. Completing the process discussed in this video memorializes your efforts and the patient's informed decision in the record. If an allegation should arise, the discussion and subsequent documentation helps to support your defense. Questions? Contact our dedicated patient safety and risk management team